So what if I come in and I'm like, I want you to revamp my vagina? Like, what do you tell someone that's my age? Do you do all different kinds of ages?
I do all different kind of ages. And look, every person is different and anatomies are, of course, different. So depending on what's going on, let's say talking about the vagina since we are, because then we can get back to labias. So vagina is the part that's inside, correct? And that's the part that penis enters it. So you want to make sure, I mean, in my mind, you want to make sure that the angle is good because first of all, it's not, oh, it looks cute. It doesn't look cute. You want to make sure it's functional. It's like,
and it's not just functional for the penis, it's functional so the woman can have an orgasm. Correct?
Exactly. Yeah. So imagine, God forbid, if you get a problem and one of your eyes go blind. They can take it out and they can basically put a fake eye that looks exactly like your eye. And it's going to look very cute, but is it going to have a function? It's not. So same thing with the vagina. You can make it look cute, like back in the days when people wanted to get married. In Iran, we have this saying, they would actually put the makeup around this woman who, let's say, had a husband before and got divorced or the husband died. I mean, probably the husband died. They would do makeup around their vagina so it looks better. So we have this saying, it says, that makeup is going to make the vagina look cuter, but it's not going to make it tighter. You really have to work on the angle. That's the first thing. And of course, depending on how distorted the angle and the anatomy is, there are a few different things you can do. The most modest one is, of course, laser vaginal rejuvenation. You've probably heard about it. What laser does, it enters the vagina, it starts shooting all the walls of the vagina, and it's kind of like when you do microneedling on your face. So you're kind of doing microneedling all over your vagina. What's going to happen? When you do microneedling, your face starts rebuilding collagen and elastin, and the skin becomes a little tighter. Same thing happens inside the vagina when you do the laser. Is it going to do anything to the muscle? Absolutely not. It's going to make it slightly tighter. So that's the good thing about laser. It's good for people to get a little bit of makeover. Let's say if you get a deep fraxel on your face.
Yeah, it sounds like a deep facial. I'm the type of person, like, if I'm going to do something, like, let's do it. The laser sounds kind of like blasé.
So next step after that, and exactly. So you are the facelift kind of person. You're like, if I want to do it, let's do a facelift. So everything.
Yeah, instead of like doing I'm an intense person, I would say.
No, I mean, I completely agree with you. If you want to do it, you want to really enjoy it. So I'm not going to tell you about the next step after laser. We're going to come back to that. So the most drastic one that really fixes everything is a full-on vaginoplasty. And in vaginoplasty, what you do, you like literally bring the muscles back together, bring the vaginal mucosa together. You like literally tighten everything from inside in the part that matters. And that is very important. So vagina is a long canal. What happens, a lot of doctors who don't have experience and they start doing this, and unfortunately it's gotten more and more because there's so much more demand for it. Cosmetic gynecology grew by 1,000% in the past 2 years, just in labioplasties and vaginoplasties. So, you know what is a cash procedure? Let me do it too, because I used to deliver babies and I know how to stitch people up. And I haven't done any, but the patient comes to me, they're like, oh, do you do it? Sure.
So after you give, or during your birth, you will actually come in and stitch the person up?
Not during the birth. We're going to do it after. But I'm telling you
But right after, right? You're the doctor that would stitch them up.
I don't deal with deliveries anymore. The last baby I delivered actually was 6 years ago. And I completely stopped that because I'm focusing more on endometriosis and cosmetic vaginal surgery. But what happens is that some people think they need to tighten the vagina all the way down to the cervix. And that is wrong, because that's what messes up the angle and the anatomy of the vagina. And patients come back, they're like, oh, I'm dry, I don't feel well, I don't get the orgasms. And then you see that the doctor thought they did a very good job because they went all the way down and they actually It took them longer too, but they overdid it. So you really want to do it in the part that you have to do it, which is really the first like 4 or 5 centimeters of the vagina. It's like the penis. What's the most sensitive part of the penis is really the glands of the penis. You can hold the bottom part of the penis and do whatever with it. It gets stimulated, but is not like the tip of the penis. So same thing with the vagina. You want to work around the area that affects the clitoris and the G zone.
You mentioned better orgasms. So are you actually doing something in surgery that's giving people better orgasms, or are
Yes.
you
It
teaching
sounds like
them?
fixing the angle is a big part of it, right?
Exactly.
You got to get that projector out.
Well, I've been
Or
paying attention.
protractor.
Well, it sounds like if your angle's off, then you're missing the angle. Then you're putting yourself at the
Don't
deficit
fuck
here.
the angle up.
Listen, if the angle is right, as you said, it's just you can be blind. You can just put a finger in there and it's going to reach the
right
G
place.
zone and the clitoris, so the right place. So you really want to correct the angle. Now, there is a procedure in between these two, because I saw some patients don't want to go all the way with a full-on vaginoplasty and be like 6 weeks, they can't have sex, they can't do anything, and they don't really want to settle for laser vaginal rejuvenation. So 3 years ago, I established something. I mean, I did it so many times on patients. I call it kind of a minimally invasive vaginoplasty. It's trademarked as Vagilangelo, and I've trained a lot of doctors on it. So in a Vagilangelo procedure, what we do 2 things. I don't try to fix the whole thing. I just, with like 3 special stitches, I fix the angle of the vagina. And at the same time, I inject the G spot with the patient's own PRP, which we're going to talk about that. So you do both of those.
So smart.
The good thing about that,
Why are you whispering that?
Because it's really smart. I mean, that's essentially what I think works the best on the face is injecting your own blood. So that would make sense if you inject it in your G spot, that it's good for the nerve endings, right?
100%.
Yeah.
And for the blood supply and for the lubrication. So you can even just do, we inject PRP. I love PRP. I put it anywhere, even on myself. It's great. So, and we can put it in penis too, which I do. So if
I need help, yeah.
If you need help. So what we're going to do is I'm just going to get the whole shebang, and then you can get PRP injected in your dick. Can he be awake though? I don't want him to be asleep. He needs to be awake.
He's not going to feel it because you put some ice on it. The problem with men.
Just put me out. No.
Listen, the problem with men is that they see the needle. I'm the same. I can cut people all day, but if they want to take my blood, I'm going to start screaming. So
That's so interesting.
That is so crazy to me that you do what you do and you're scared to get your blood taken.
I don't like it.
Well, you know what's funny too is like Lauren's had medical procedures. She talked about, she said boob jobs, stuff like that, and she cannot take her even during birth. She will not give her blood. She doesn't want anyone to do any kind of IVs or anything. It sounds like, but she's not squeamish when she has to get a surgery at all.
With beauty, if it's beauty. If it's a filler or Botox,
but you guys taking
fine.
blood is so much easier than what you guys are both talking about.
It's invasive.
Yeah.
Wait, so you can inject PRP to make an orgasm better at the same time that you're doing vaginoplasty?
Of course, we can do that. And with Vagilangelo is that the reason we came up with that procedure is that there's no downtime for it. So it's not really surgery. You do it in the office. It takes 10, 15 minutes. I have a lot of doctors right now all over the US who came and got trained with me, and patients really love it because instead of going through the whole vaginoplasty, they go in the office, they basically make a cut, they put some stitches in the places they need to do, they correct the angle, they inject the G spot, and the patient is done. No sex for 2 weeks. And after that, when they start having sex, they are at least 50% better. Now, if you did the full-on vaginoplasty, and G-spot injection at the same time, you would be 100% better. But remember, you're going to have the downtime and the price is going to be a lot higher.
What is the price and what's the recovery like? Let's say you want to do the whole shebang.
There are lots of things in the shebang. Like which one? Just inside.
Maybe if a regular vaginoplasty with the injection of the G-spot. How much is that?
So injection of G-spot usually, across US, people charge anything between $1,000 to $1,500. just to inject PRP.
Okay, that's about what I would think the PRP would be. So what if you're going to do the whole surgery though?
So for vaginoplasty, depending on where you get it done, what city, because the cost of surgeries, a lot of it goes to anesthesia and the surgical facility and all of those stuff, which I don't like to deal with those. But considering all of those for vaginoplasty, you pay something between $8,500 to like $10,000.
And is that the best special is that the big shebang?
So no, that's just the vaginoplasty. If you want to get the labias nicer too, that's completely separate. That's almost like the same price, sometimes higher.
What's the most expensive vagina that you've ever done?
Around $50,000.
That's about what I would think. Whoever's out there with the $50,000 vagina, I would love to interview you. Just saying, if you want to drop into my Instagram.